This video is about anemia, a medical condition characterized by a decreased level of red blood cells or hemoglobin in the blood, which leads to a reduced ability of the blood to carry oxygen. The article will discuss various types of anemia and their causes, with a focus on iron deficiency anemia, which is one of the most common causes of anemia. The article will also present information from a study published in Europe PMC that analyzed the prevalence and health impacts of iron deficiency anemia in several countries. The article will conclude by discussing effective interventions for preventing and treating iron deficiency anemia, including iron supplementation, food fortification, and changes in dietary habits. Anemia is a medical condition characterized by a decreased level of red blood cells or hemoglobin in the blood, leading to a reduced ability of the blood to carry oxygen. This can result in fatigue, weakness, shortness of breath, and an increased heart rate, among other symptoms. There are various types of anemia, each with its own causes and treatment options. One of the most common causes of anemia is iron deficiency, which occurs when the body does not have enough iron to produce hemoglobin. Iron is an essential component of hemoglobin, the protein in red blood cells that carries oxygen from the lungs to the rest of the body. When the body lacks iron, it is unable to produce enough hemoglobin, leading to anemia. A study published in Europe PMC found that iron deficiency anemia is a common and preventable cause of anemia in many countries, particularly among women and young children. The study analyzed data from several countries and found that iron deficiency anemia affects over 30% of preschool-aged children and 40% of women of reproductive age in some regions. In addition, the study found that iron deficiency anemia can have a significant impact on health, including reduced work capacity, impaired cognitive development in children, and increased maternal morbidity and mortality during pregnancy. The study also found that there are several interventions that can help prevent and treat iron deficiency anemia, including iron supplementation, food fortification, and changes in dietary habits. Iron supplementation, in the form of pills or fortified foods, can help increase the body's iron levels and prevent anemia. Food fortification, in which iron is added to commonly consumed foods such as flour or rice, can also help prevent anemia. Eating a diet that is rich in iron, such as meat, poultry, fish, and leafy green vegetables, can also help prevent and treat iron deficiency anemia. In conclusion, iron deficiency anemia is a common and preventable cause of anemia that can have significant health impacts. Effective interventions, such as iron supplementation and changes in dietary habits, can help prevent and treat iron deficiency anemia. It is important for individuals, particularly women and young children, to be aware of the risk factors and symptoms of iron deficiency anemia and to seek medical attention if they suspect they may be affected. Thank you for taking the time to watch this video. If you enjoyed what you saw and would like to see more content like this in the future, please consider hitting the like button and subscribing to our channel. Your support means a lot to us and it helps us to continue creating high-quality content for you. Also, if you enjoyed this video, we have a lot of other great content that we think you might like. Be sure to check out some of our other videos on this channel, and if you find something you enjoy, please let us know in the comments. Thank you for your support, and we look forward to bringing you more great content in the future.